Good evening, everyone. So, dear friends, now we are starting our class. Very good evening. So, this is a very common word. We have listened many times. The word is hypoxia. So, whenever we are discussing about the coronavirus, hypoxia is a very common word. And we have listened happy hypoxia. So, what is the meaning of happy hypoxia? So, what is the meaning of hypoxia? The meaning of hypoxia, the availability of oxygen. The availability of oxygen for our blood cells, for our body. So, if it is lesser than the availability of oxygen lesser than from the normal, that is called hypoxia. Generally, as a human, we are living in this cosmos happily, and our both lungs having certain types of pressure inside. So if you take the lungs, both the lungs, so this is the right lung and this is the left lung. And the lungs are having certain type of pressure. And the value of this pressure is 760 mm of mercury. So this pressure is something like that. Like if I am pushing some object, I am pushing this object on this side, on this side. And someone else is putting this object from this side. So this is the opposite pressure. So because of this opposite pressure, this object will remain constant at their own place. So look at me. If I am pressurizing my hand like that, so I am pushing this mobile like that. I am pushing with the help of this hand. So this mobile is going on the opposite side. But now what I'm doing, I am pushing this mobile from the right hand and from the left hand together, both the hand. Then this mobile will remain in the center. This is not going this side. Even this is not going this side. So this is remaining in the center. In the same way, if we see this cosmos all around, the pressure of oxygen, the pressure all around in this cosmos, the pressure of air is near about 760 mm of Hg. And the same pressure is available in the lungs, that is 760 mm of mercury. So lungs are maintaining the lungs are able to maintain the shape. So here, so if we look at both the lungs, the inside we are having 760 millimeter of mercury pressure. Sorry. And even outside in the atmosphere, we are having 760 millimeter of mercury pressure. And if we see this cosmos all around, near about 20% part belong to oxygen, O2. So if we see the pressure of this, the pressure created by the oxygen is 21%. So I told you the total pressure is 760 and the 20% is created by the oxygen. So it will be near about, you can calculate. So if we do the calculation, 760 into 21%. So near about 160 millimeter of mercury pressure is created by the oxygen. So if I am sitting here, the oxygen all around is having 160 millimeter of mercury. This is the pressure. And this is the pressure because of this. This pressure is created by oxygen all around. Now, if I go in my lungs, inside the lungs, the inside the lungs, the pressure of oxygen near about 100 or 104 millimeter of mercury. So outside pressure is near about 160 and inside the lungs pressure is near about 100. This is the pressure of oxygen. So what is happening? Suppose this is the outside and this is the inside. The pressure outside of the oxygen is this much, 160 mm of Hg. And pressure inside of the lungs is this much, near about 100 millimeter of mercury. Then what is happening? The oxygen is coming inside the lungs because of this pressure difference. So we are continuously taking the oxygen in this way because of the pressure difference. And we are able to maintain the normal oxygen level. Then this oxygen will transfer in the body. Transferring this oxygen in the body, Now, suppose if you are going on the hill, some hill, or you are going on the height. As soon as you are going on the height, the pressure of oxygen is decreasing. Suppose from the 160, then slowly 140, 120. So slowly, as we are going on the height, this pressure is decreasing. So now the outside pressure is 120 and inside pressure is 100. So very little difference. So outside pressure is this much and inside pressure is this much, very little difference. So the lesser oxygen coming inside lung. So this condition is called poor availability of oxygen. Or in the medical term, we tell it hypoxia, the poor availability of the oxygen level. And this is a natural process. When we are going on the height, the oxygen level is decreasing. So when we reach on the height, automatically we start feeling little breathlessness. And slowly our body do adaptation. It takes few days. But initially, this oxygen which is coming inside our body is not enough. So we can understand this thing in this way. There is a one flask, bigger flask. And there is a small flask. And there is a small flask. In the bigger flask, we are having more oxygen, near about 160 mm of mercury. And the smaller flask, we are having lesser, that is 100 millimeter of mercury. And we are combining these two flasks. So automatically, the oxygen is transferring from the higher level to the lower level. So we are receiving oxygen all the time because in our lungs, we are having always the pressure of oxygen lesser than the from the outside of this atmosphere. Now suppose you are going on the height and this is decreasing. Now this availability of oxygen is becoming lesser. Now suppose it is only 120 millimeter of mercury. So now new availability of the oxygen, new availability of oxygen outside is lesser. And this is our lungs where we are having 100 millimeter of mercury. This is the pressure. So comparatively, we will receive the poor oxygen. So the transferring oxygen level will be lesser. So this condition is called hypoxia, which is happening naturally when we are going on the height. Now suppose one patient suffering with the asthma, then what is happening in the asthma? So this is the two lungs. And our bronchi is like a tree. We know tree. This is the tree. Then in the tree, we are having one branch. Then we are having sub branch. Then we are having sub branch in the tree. And the last of this, we are having leaves in the tree. So that's why in the same way we are having our bronchi. So we are having one main branch, then sub branches. Then we are having sub branches, and at the last we are having this air sac, which is called alveoli or air sac. In asthma, what is happening? There is a problem because oxygen is going from the main branch, then it is going in the sub branches, then it is going in the sub branches. In asthma, what is happening? There is a blockages in the branches or sub branches. So we can understand here. So this is the main branch. Suppose this is the sub branch, and this is the sub branches. The oxygen if going from here. So if there is a blockages here, so oxygen is not able to go past completely. Asthma is called bronchospasm. Means there is a spasm inside these branches. So because of that, the oxygen is not reaching in the adequate amount. So what is the result? Again, poor oxygen supply. This is also called hypoxia. So when oxygen want to come inside the lungs till the alveoli, but it is not reaching properly because of the blockages in the pathway. Can you see the image? You can't see the image. Yes, definitely you can see the images. So now, so this is the second condition we can understand hypoxia means because of the blockages in the pipeline, blockages in the bronchi, this condition creating the hypoxia. Now, in the COVID-19, what is happening? In the COVID-19, if we talk about these are the two lungs. And this is the bronchus, then sub branches, then sub branches, then sub branches. And this is the last unit, that is alveoli. What is happening? In the alveoli, this is the last unit, alveoli. The alveoli or air sac is collapsing. This is collapsing. This is number one thing. Size is decreasing. So not able to receive the complete oxygen which is required. And the second thing, what is happening? Second thing is happening, if this is the alveoli, and whatever oxygen received, ultimately alveoli has to transfer in the blood vessels. This is the blood vessel. And blood vessels will transfer the carbon dioxide in the return. But between the alveoli and these blood vessels, there is a lots of fluid is depositing here. So this fluid is called interstitial fluid. Means in between the alveoli and blood vessels. So this is disturbing the exchange. So either the oxygen is not going properly, even CO2 is not coming properly. So when oxygen is not going, this condition creates hypoxia, the poor oxygen in the blood. Even CO2 is not going out. So there is an excessive amount of CO2 in the blood. That condition is called hypercapnia. So this CO2 is creating acidic blood. So slowly, the oxygen level is decreasing, and hypoxia is increasing. And when patient is sitting in front of you, patient is having too much hypoxia, but still alive. This is in the condition of COVID only. Like in other hypoxemic condition, person will go for ventilator and even will go in the critical condition. But in the case of COVID-19, many times person is showing very little symptoms, happily sitting. Even it is dangerous, happily sitting, talking. That's why we are telling it happy hypoxia. The normal level of oxygen concentration should be 95 millimeter of mercury, more than. It should be more than this. And when it is reducing below 90, then it is dangerous. Now, I will tell you one very excellent way to improve the oxygen. 1 minute. There is a very excellent way to improve the oxygen level. You have to practice this every hour. Every hour. What is that? Let's see. And I have advised this thing to my many patients, and definitely they are improving. Home remedy. Very excellent home remedy to improve the oxygen level. Even you can try, you check your oxygen level, and after applying this technique, just you think about this Sankhnath. Just you do this every hour 2 to 3 times. I have done practically. I have seen practically. Patient who is always below 80 millimeter of mercury. But I told even you tired, even you get tired, but do 2 to 3 times every hour this thing. Sankhnath. The excellent way to improve the capacity of the lungs. Excellent way. You just try. Because once I in the nowadays in the hospital, if the patient is having poor oxygen level, they are giving one exercise. Pull the air, just pulling the air, sucking the air, like that. So the second exercise you have to advise, pull the air in. So just by doing these two things, like do the exhalation by Sankhnath, see the changes. If you have oximeter, then you can try. You check your oxygen level before and check your oxygen level after. You will see immediate changes. These are very excellent exercises we are doing traditionally. Got it? So in this way, we can improve our lungs. So when we do the Sankhnath, we are doing the complete exhalation and we are pushing the complete CO2 out. When I do like this, the carbon dioxide is coming out. If carbon dioxide is more in my body, then it will create acidic blood. It will create acidity in the blood because the nature of CO2 is acidic. The normal value of CO2 in the blood near about 25 or 30. But many times, patient going to the hospital, the oxygen level is dropping down. The normal value is 95, but it is reaching to the below 80, below 70, even below 60, even below 50, which is very dangerous. On the other side, the CO2 level is increasing. The normal level should be not more than 30, but it is reaching even more than 100. And if you take the patient in the hospital, they will put on the ventilator. Otherwise, the doctor will tell you this excessive amount of CO2 will make your blood acidic. And this acidic blood, patient even may go in the unconsciousness, and even in the coma. But when we are pushing the air from the lower level of lungs, then we are taking out the CO2 out, and we are removing the acidic nature. So in that way, we can do two exercises. The exercise is one, like pushing the air out, and the exercise number two, inhaling the air, sucking something. Okay, so in this way. Now, yesterday I told you the meaning of infection is a bind, and there is 8 types of penetration. Total, there is 8 types of penetration which can be done by any bacteria or virus. We have already discussed 2 types. We have already discussed bind cold attack, bind cold invasion, type 1 and type 2. In the type 1, we are having cold plus plus. In the type 2, we are having bind plus plus. And we have seen the protocols. Now we are going on the third type. The third type is called when any virus attacking and creating the heat. So this is called the attack of external bind heat. The attack of external bind heat on our immune system. So yesterday we have discussed the attack of bind cold. Now we are discussing the attack of bind heat, or we can tell external bind heat. So when this external bind heat attacking on the human immune system, then what is happening? This is attacking on our defense system, which is called Tai Yang. So there is a fight between the Tai Yang and external bind. So when this fight is going on, means the COVID-19 is attacking in your body, and the fight between this COVID-19 coronavirus and our immune system is going on, then body creates some symptoms. The number one, a very prominent system, that is called sore throat. Sore throat. Or tonsillitis. Either we can tell tonsillitis, or we can tell sore throat, or we can tell pharyngitis. Whatever happened, something wrong in the throat, some heat in the throat, some heat sensation in the throat. So whenever someone is feeling sore throat, tonsillitis, so feeling of sore throat, tonsillitis, pharyngitis, means something wrong in the throat. So throat is getting affected when there is a heat with the virus. And the first defense level, that is Taiyang, and the second defense level is Yang Ming. So the virus is fighting with the Taiyang and in the Yang Ming. The meaning of Yang Ming means large intestine and stomach. So this virus will create lots of problem in the large intestine and stomach. So what problem will be created by this virus in the large intestine and stomach? Let's see the root of the large intestine and stomach. So if you see this image, you can see the large intestine meridian is reaching to the nose. And when this large intestine meridian is fighting with the coronavirus, then this person will get common cold. This person will suffer with the throat problem. It may be pharyngitis, laryngitis, sore throat, tonsillitis. The tonsils mean what is the meaning of tonsils? The meaning of tonsils are policemen of buccal cavity. And what is the work of policemen? To protect our immune system. So this person is getting many symptoms connected with the large intestine. Even we can see the stomach meridian. If we see the root of the stomach meridian, the stomach meridian also crossing the throat and even crossing the chest. So when this virus having intention to create the infection in the lungs, stomach meridian is also trying to protect. So there are many symptoms in the body like pain in the throat, pharyngitis, laryngitis, sore throat, and common cold. And also person will suffer with the mild fever because body is fighting, and with a fight there will be lots of chemical are secreting. They are creating the feeling of fevers. So this person having swollen tonsils, because what is tonsils? The tonsils are the policemen of buccal cavity, the policemen of this area. So they are fighting, so they are swollen. The swollen tonsils are showing that something wrong, some infection is there. So in that condition, whenever we see that swollen tonsil, just remember this is heat with the wind heat. So the first responsibility throughout the heat. If there is a heat more in the body, even we will get more symptoms like dark urine, lesser or scanty urine. Even we can get thirst. These are the outcome of heat. So the first duty, as soon as we get the sore throat, expel heat. Expel the heat. As soon as we expel the heat, means we are doing the opposite action of the virus. How can we expel the heat? So we are having very wonderful points. Li4, Li11, and triple Balmer 5. Remember these 3 points, these 3 point unit always excellent for expelling the heat. You know, when there is a attack of wind cold, attack of wind heat, so it may create common cold, it may create lots of problem in the throat, which we have discussed. Even it may create red rashes. Suddenly we see many kids are getting red rashes all around. Red rashes on the face, red rashes on the arm and body, below the eyes. What is red rashes? So the red rashes also are wind heat, the attack of wind heat. So as soon as you see the red rashes, you can treat wind heat. Even after recovering the COVID-19, many persons still feeling some skin problem. So as soon as you get the sore throat, common cold, or any pain in the throat, or red rashes anywhere in the skin, just do the treatment of infectious heat, wind heat, and expel the wind by Li4, Li11, and triple Balmer 5. So the Li4 is the distal point. The Li4 is the distal point of this area, this Li4, distal point. And Li4 is also very good anti-inflammatory. Now, the triple Warmer 5 is the excellent point of this complete area. Because triple Warmer is the husband of pericardium. And when we do the stimulation of triple Warmer 5, the triple Warmer 5 is the Leo points of the triple Warmer. And the meaning of triple Warmer means Warmer, heat. So when we are doing the sedation, it is removing the heat from the chest cavity. So we have removed the heat from the upper part with the help of Li4. From the chest cavity with the help of triple Warmer 5, and the Li11 is the best point to expel the heat outside. Let's see the location of all the 3 point Li4, triple Warmer 5, and Li11. We have to sedate all the 3 point as soon as we see any heat symptom in the body. Either this is the red color rashes with itching, or this is the mild fever with common cold, or the pain in the throat, sore throat, tonsillitis. So let's see the location of Li4. Yesterday we have already seen the location of Li4. So this is the first metacarpal bone, and this one is the second metacarpal bone, and in between we are having this muscle. The name of this muscle is interosseous muscle. In the center we are having Li4. This is a very good point for removing all types of infection and inflammation. So we have to sedate Li4 bilateral. The second point is Li11. So Li11 we can see in this image. So this is the elbow, and this is the outer crease of the elbow. This is Li11. You can see my arm. This point is very famous, and many of us are already using this. The Li, so look at my arm. So if I fold my arm in this way, so we can see this outer crease. This is the outer crease. This is called Li11. So we can see the last point of this crease here. This is called Li11. Now, if we see the location of Li11, so Li11 is a very excellent point for migraine headache as well. We are using Li11 point for headache because the Li11 point is removing the heat. So if because of the excessive stress, we have increased our heat. So with the help of Li11, we can remove the heat from the head and we can calm down this. So Li11 is the excellent point for headache and migraine. So if anyone is suffering with a headache or migraine, put the Li4 as well as Li11 on the outer crease. And the third point is called triple wormhole 5. The triple wormhole 5 is the Leo connecting point of triple wormhole and removing the unwanted heat from the chest and even from the throat area. So from this dorsal wrist crease, we can see the crease here. From this, if we go 3 finger down or 2 chin down, so this is the location of triple wormhole 5 in the center. In the depression between these two bones, one side we are having ulnar bone, one side having radius bone. In between we are having depression, 2 chin away from the wrist. This is the location of triple wormhole 5, which is the excellent point for expelling unwanted heat from the chest and throat. Even the triple wormhole 5 is very good point for the thyroid and throat. And it is also very good for the chest cavity. Because triple wormhole is the husband of pericardium, and pericardium is available in the chest. So just by doing the sedation of 3 points, you can reduce the itching, body races, red spots all around in the body, and sore throat, tonsillitis. So these are the 3 points. So there is no relation with the meridian. These red races may be anywhere. It is not mandatory that these red races will be on LI meridian or stomach meridian. No, they will be on the skin anywhere all around. And we have to do the sedation. We have to reduce. So if you are having always sore throat and common cold, it means the body defense system is fighting all the time with the external attack. So body defense system fighting all the time. If this is all the time, then we will discuss what to do. See, fever may be there or fever may not be there, because fever will come when virus will enter inside. Right now fighting is going on. So there may be fever or there may not be fever. Once virus cross the defense level, defensive chi level, and once virus reaching in the inner level, then fever will be for sure. Right now, no mandatory that fever will be there. It may or it may not be. Even if fever is there, it will be very mild fever right now, because this is the defense system is going on. And remember one thing, the cause of sore throat may be stomach heat also. So we will discuss sore throat also, don't worry. If someone is having stomach heat, even he may get sore throat. We are going to discuss these things also, so don't worry for that. So coming back to our points. So by using these 3 points, we can work on the heat and we can expel the heat out. Now, whether this is enough? No, we will add a few more points. Why a few more points? Yesterday we have done the discussion that urinary bladder 12 is the excellent point for expelling the wind. And urinary bladder 13 is the Baxu point of lung. So when we are stimulating the urinary bladder 13, then lungs start sending their energy downward. Because many times lungs forget to send the energy downward because of the infection. So with the help of urinary bladder 13, we are able to synchronize, harmonize the functioning of the lungs. So these are the 2 points, urinary bladder 12 and 13. These are the very wonderful points. Let's see in this image. And the best technique if we do the cupping therapy. Look at this image. So these are the location of these 2 points. One is bladder 12, which is very good for expelling the wind out. And second is urinary bladder 13, which is the Baxu point of lungs. So we can do the cupping in this whole area. It may be dry cupping or it may be blood cupping. Or we can do the gua sha as per our previous discussion. Scraping the area with the help of gua sha, or we can sedate the point in the Buell magnet, or we can sedate the point in the body acupuncture. Ultimately, our intention to sedate these points. So as soon as we do the sedation of urinary bladder 12 and urinary bladder 13, this is the very good for if any virus is having intention to affect the lungs, we will expel immediately. Now, so we have added two more points. That is a urinary bladder 12 and urinary bladder 13, and we have sedated both the points. Now, the very good point for all types of throat problem. Only single point, that is lung 11. If you do the sedation of lung 11, it will remove the pain from the throat. Many times I have applied this point. Someone is telling, can you do something for my throat? Just put one magnet only on this LU11, which is the last point of lung meridian, or take out the few drops of blood from the lung 11, or put the needle with the intention of sedation. If you are putting the Buell magnet, so put the Buell magnet for 12 hours, just one single magnet, a small magnet, and you will see throat pain disappeared. So the LU11 is the very good point to removing any infection from the throat. And so we are using this point for the sore throat, even for the swollen tonsils and any types of throat pain. Now, so we have added one more point. Few points will be common, like we have discussed yesterday. We have discussed yesterday that gallbladder 20 and 16, these 2 points are found in our head region. So this is the hairline, and the midpoint is governing vessels 16, and on both the side we are having gallbladder 20. So gallbladder 20 and governing vessel 16, if we do the sedation of these 2 points, these points expelling the wind from the head. So a person is feeling very good if he is suffering with a headache, heaviness in the head area. So we are stimulating these 2 points, governing vessel 16 and gallbladder 20. So gallbladder 20 point found in both sides. So as per this image, look at this image. In this image, we can see this is the skull bone and this is the neck and this is the junction. In the junction, center point is governing vessel 16. We can feel the clear pit here. We can place this point for removing the wind from this head region. And on the both side, we can feel another depression. So from the ear, if we go 4 finger back, so we will find one depression here below the skull. That is gallbladder 20. So we are doing the stimulation of these points, whether we can do in the body or we can do in the Buell. So these are the 2 points for removing the headache. Now, one very good point for reducing the fever, and this point is very famous. And I have already applied this point for many patients for fever. That is called governing vessel 14. The governing vessel 14 point, which is found between the governing vessel 14 point is very good, which is found with where our cervical is ending and thoracic is starting. This point is excellent point for the fever. We can see in this image. As soon as our neck is ending, how can we feel where neck is ending? Our neck is having the length of forefinger. So you can keep your forefinger on the back side and you can do like that. So you can make the proper grip and you can feel your neck because the total length of neck is forefinger or three chun. As soon as your fourth finger is completing, we are getting one elevated part, protruded part. We have to put the needle there only. That is called governing vessel 14, the very good point for the fever. So how, so this is the point. So in that way, so by using this protocol, we can remove the attack of wind heat completely. So whether it is the infection of the tonsils, we want to treat the tonsils, tonsillitis, pharyngitis, laryngitis, pain in the throat, any problem in the throat, red races over the skin, we can help the patient with the help of this point protocol. That is LI4, LI11, TW5. Then I told you urinary bladder 12 and urinary bladder 13. Then governing vessel 14, LU 11, gallbladder 20, and governing vessel 16. And we have to sedate all the points. So this is the protocol of attack of external wind heat. So as soon as we get the sore throat, apply this protocol immediately for helping our defense system, Tai Yang. Got it? So this is the completion of this protocol. So we can stimulate these points both the side, right side and left side together, all the points together, expel the wind heat, the infectious heat out. Done. Oh, time is over very fast. Okay, I was thinking to cover a little more part, but time is not in our hand. So now doing the few minute break, then we'll do the Hindi recap. तो अभी हम 2-5 मिनट का ब्रेक करते हैं, फिर हम हिंदी में समझेंगे इस चीज को. अभी कल से हमारी क्लास होगी. फ्रॉम टुमारो ऑनवर्ड्स we will do the class for enrolled participants. So we have already made the group of enrolled participants. So I will send the link in the final group. So link will be different. So we don't have to join from this link now. So kindly join tomorrow from the different link, which I'm going to send in the final group of COVID. Okay, so thank you so much. I will post this video for all of you so you can see anytime. अब हम 2-5 मिनट का ब्रेक करते हैं, फिर हम हिंदी में रिवाइज करेंगे. कल से हमारी क्लास इनरोल पार्टिसिपेंट्स के लिए होगी और लिंक दूसरी होगी, तो इस लिंक से ज्वाइन ना करें जो अभी तक थी. अब हम एक अगली लिंक भेजेंगे हमारे फाइनल ग्रुप में. ओके, तो अभी हम 2 से 5 मिनट का ब्रेक करते हैं, फिर हम हिंदी में स्टार्ट करेंगे. थैंक यू सो मच. जो लोग भी इनरोल करना चाहते हैं वो मुझे मैसेज कर सकते हैं. Those who want to enroll, they can send me message. So I will provide the link. They can send me message at this number 816-0088-512. The amount to enroll is only 1,700. And even we are going to learn a very deeper, and we are going to learn all and multiple types of lungs infections during this webinar. Okay, तो थोड़ा सा ब्रेक करते हैं, फिर हम हिंदी में पूरा रिकैप करते हैं. थैंक यू सो मच.